Hi everybody, welcome back to the channel. It's Dr. Mivi Singh, your specialist here. Today we're going to be looking at how medical cannabis can help in patients who are unfortunately suffering from cancer. Now, cancer is one of those absolutely horrendous diagnoses. Nobody wants anybody to get it, and it's very sad when someone is diagnosed with that horrible condition. Now, cancers can affect any parts of your body. How is medical cannabis beneficial to those patients suffering with these horrible different diseases? Well, what can happen when someone has cancer? Someone can actually have a reduction in appetite and then as a result suffer weight loss. So what cannabis can do is actually it can stimulate your appetite and therefore allow you to feel the need that you need to eat and therefore prevent this unintentional weight loss. What it can also do is actually prevent some of the nausea. Nausea not only caused by the cancer, but nausea that is also caused by some of the treatment that someone may be having through either the medicines, chemotherapy, radiotherapy, or those type of pharmaceutical agents that are used. Another feature and symptoms that patients tend to get is unfortunately pain. Now for pain, a lot of patients will be put on medicines and a lot of them are actually on opioids. Now they can actually slow down the bowel, causing the problems like we mentioned before and constipation, but also they can get other side effects from that, causing them to feel drowsy, which can also then drop the mood, which obviously is not going to be in the healthiest of places. And what medical cannabis can do is it can alleviate pain without causing those different types of effects. So it can alleviate pain and reduce it to a far greater deal without causing the constipation or nausea effects. This means that the pain is going to be a lot more manageable and the patient's going to be feeling a lot better off. And also the different components in the cannabis plant, like the cannabinoids, the THC and the terpenes, can be used to be directed to be terpene specific to energize and improve the feeling that the person has within their own mind and body, and therefore can help alleviate the symptoms and features that come in with of depression and anxiety that unfortunately are quite synonymous with the diagnosis and treatment of cancer. Some patients can even end up having poor quality sleep as a result of having the cancer diagnosis because they're either having anxiety about it or nightmares. And medical cannabis can help treat those specific symptoms when used in the right way, the right type of strain, the right type of product, through the right type of route at the time of going to sleep. When you have these changes in uplifting mood, bettering sleep, reducing pain, reducing nausea, and bettering of appetite, you're going to have a patient who is going to be in a much better position than otherwise. Because of the different routes that cannabis can be ingested, there's always some way or form that can be given to a patient which is going to be more applicable to them. So it doesn't always have to be an oil under the tongue that they have to absorb, and it doesn't just have to be something that they have to vaporize to inhale. And again, not every patient is going to be suitable and not every patient is going to fully benefit from it. And that is why it's important to have the correct consultation to see whether you meet the requirements, and then also to see whether you potentially may have risks that may make you not suitable for treatment with medical cannabis. And that's why specialists exist like myself, and that's why it's important to go through the right processes. So that's the end of this video. I hope you enjoyed it. Remember to like, share and subscribe. It's important to grow this channel so that I can keep making more videos like this. My name is Dr. Mivi Singh. I'm your emergency medicine specialist. Thanks for watching. Stay blessed.